Hi everyone. Today we are going to talk about World Health Organization as one of the organizations which influences nurses and nursing in Pakistan and other countries, and how does it, as well as the community health and public health of any country. So World Health Organization was established in 1948. It is a specialized non-political health agency of United Nations with its headquarters in Geneva, Switzerland. It aims to provide leadership on global health matters, and it has got 6 semi-autonomous regional offices and 150 field offices worldwide. It meets annually, usually in May, and every year 7th April is celebrated as World Health Day. The vision of World Health Organization is that highest possible level of health is attained by everyone, and the mission is to lead strategic collaborative efforts among member states and other partners to promote equity in health, to combat disease, and to improve the quality of and lengthen the lives of all people in the world. As I said, it is divided into 6 regions, and here the explanation of those regions, what includes in each region, as well as the office of each region. This map shows you the countries by World Health Organization membership status, so you can see that pretty much all of the world is member of World Health Organization. What does it do? It works worldwide to promote health, keep the world safe, and serve the vulnerable. And the goal is to ensure that the recent goal, Result 5-year strategy of WHO, is that it aims to ensure that 1 billion more people have universal health coverage to protect 1 billion more people from health emergencies and to provide a further 1 billion people with better health and well-being services. It has no power to impose health policies on national governments, but acts as an advisor and offer guidance on best practice in disease prevention, health, and health improvement. It doesn't act as a world doctor, so it doesn't have any of those powers, but it has the advisory capacity and has the ability to influence organizations, influence governments and nations by providing them accurate information and therefore suggesting what needs doing. So with regards to universal health coverage, World Health Organization focuses on primary health care to improve access to quality essential services, works towards sustainable financing, financial protection, improve access to essential medicine and health products for people, and train the healthcare workforce and advise on labor policies. It also supports people's participation in national health policies and improves monitoring, data, and information. With regards to health emergencies, it prepares for emergencies by identifying, mitigating, and managing risk. And these could include, like, for example, COVID-19 or any of the other health-related emergencies that you could think of, prevent emergencies and support development of tools necessary during outbreaks, detect and respond acute health emergencies, support delivery of essential services in fragile setting. So COVID-19 is a very good example to understand the role of WHO, where it has been collaborating with various different countries to make sure that and advocating on behalf of the nations who don't have enough access to vaccine, etc., to enable them to get the access to vaccine and to make sure that every country is participating equally. With regards to health and well-being, it addresses social determinants of health, promotes intersectoral approaches for health, prioritize health in all policies and healthy settings. In addition, it also focuses on human capital across the life course, non-communicable disease prevention, mental health promotion, climate change, and in small island developing states, antimicrobial resistance, and elimination and eradication of high impact communicable diseases. WHO is a federation of 194 member states. The member states elect the Director General who leads the organization in achieving its global health goals, and World Health Assembly, the Executive Board, and the Secretariat, which is headed by the Director General of WHO, makes the organization in itself. If we talk about World Health Assembly, it is the supreme governing body of the organization, who meets annually, generally in May, in their headquarters in Geneva. The Assembly aims to determine international health policy and programs. It reviews the work of past year and approves the budget for the next year. And it also aims to elect member state to designate a person to serve for 3 years on as executive board. Now, With regards to executive board, is composed of 34 technically qualified members elected for 3 years term. The annual board meeting is usually held in January when the member agree upon the agenda for World Health Assembly and the resolution to be considered by the Health Assembly. A second short meeting takes place in May as a follow-up to the Health Assembly. The main function of the board is to implement the decision and policies of the Health Assembly and advise on generally to facilitate its work. Secretariat is headed by Director General, who is the Chief Technical and Administrative Officer of the organization as well. There are 5 Assistant Director Generals, and their responsibility is assigned by the Director General himself in different divisions. WHO Secretariat is composed of 14 different divisions. And if we look at the divisions, these include epidemiological surveillance and health situations and trend assessment, communicable disease, vector biology and control, environmental health, public information, education for health, diagnostic, therapeutic, and rehabilitation technology, mental health, strengthening the health service, family health, non-communicable diseases, health manpower development, information system support, personal and general services, and budget and financing. Who funds WHO? While member states provide funding via 2 routes, which is assessed contribution and voluntary contribution. The budget is biennial, spanning 2 years. Its 2020-2021 budget is almost $4.85 billion, up 9% from the previous 2 years period. Assessed contributions are calculated on the basis of country's wealth and population, whereas voluntary contributions are often targeted by the donor at specific regional diseases such as polio, malaria, or infant mortality in poorer countries. Philanthropic foundations and multinational groups such as European Commission are also major donors to the WHO. United States has been the biggest overall donor and had contributed more than $800 million by the end of 2019 for 2018 and 2019 biennial funding period. The Gates Foundation is also the second largest donor, followed by Britain. WHO has been successful in many areas and perhaps failed a little bit in some areas, and biggest examples is eradication of smallpox in the world, eradication of polio, which is not completely eradicated but nearly eradicated, Ebola in Congo and Zika in Brazil are other examples. COVID-19 is the most recent example where WHO's efforts are praised at the same time, criticized as well. In the past, WHO was also accused of overreacting to the 2019-2010 H1N1 flu pandemic, and also faced widespread criticism for not reacting quickly enough to the vast Ebola outbreak in West Africa in 2014, which killed more than 11,000 people. WHO presence in Pakistan, it was established in, the country office was established in 1960, and it provides a range of technical support services to government of Pakistan, especially in the context of strengthening health services, addressing public health issues, supporting and promoting research and health. The major areas of WHO collaboration in Pakistan again relates back to the 3 aims, which is 1 billion more people to benefit from universal health coverage, and 1 billion more people to better protected from health emergencies, and 1 billion more people enjoying better health and well-being. It works with different partners to support government of Pakistan to achieve universal health coverage and the sustainable development goals, which include United Nations, UNICEF, United Nations Population Fund, World Food Program, UNAIDS, and United Nations Development Fund, World Bank, Global Fund, Global Financing Facility, and other donor and academic institutions and agencies. I hope this information was useful. I would like to learn a little bit more about WHO by completing the activities which you have been given. If you have got any questions, please do leave me here and I'll try and respond back. And please do share the videos with others. Thank you for watching.